see you.
On behalf of our community, our board of directors, our 500 employees, our 60,000 patients, particularly our many patients who struggle with opioids, we welcome you to Londo Christian Health Center. Governor, we expect your words today to be a call for action. On behalf of the healthcare providers present in the room today, I can say with confidence that we will respond to that call. We love working and serving in our communities. We love serving and caring for our patients, particularly the ones who struggle with some of the toughest challenges, and certainly the challenges of opioid addiction is one of those huge challenges. We look forward to working with you, and we look forward to addressing the problem. Governor, thank you for coming to our community. We look forward to your words.
Thank you. Good morning. Thank you for joining us this morning. We are here to address one of the most devastating challenges before the people of Illinois, facing everyone across the United States of America, the opioid epidemic of addiction and overdose deaths is devastating families in Illinois and across the United States. I'm proud we passed legislation 2 years ago in the General Assembly on a bipartisan basis to begin to address the challenge with more resources and more support. But we have got to do even more to help the families of Illinois. The numbers are continuing to rise. The levels of addiction rising, the cases of addiction rising, and tragically, the deaths, the number of deaths from overdose from opioids is rising as well. We cannot let this continue. We've got to take even stronger action. We're here today. I am signing an executive order creating a opioid prevention and intervention task force to bring more coordination and cooperation across every state agency, every law enforcement group, every community organization and healthcare organization in the state of Illinois to better use our data, better use our training, better use our information and our resources to maximize the impact to protect the people of Illinois. I'm going to sign this executive order here this morning, creating this task force. It will be chaired by Lieutenant Governor Evelyn Sanguinetti and by Dr. Nirav Shah, who's the head of the Illinois Department of Public Health. They will co-chair this task force. They have been working for months to draft a comprehensive coordination opioid action plan. They will be introducing the detail on that this afternoon in Springfield. And then this task force will be charged with setting specific goals and implementing the opioid action plan so we can attack this scourge against our families on a very comprehensive, very aggressive basis. With that, I will turn the podium over to Lieutenant Governor Evelyn Sanguinetti, who's co-chairing the task force. Evelyn.
Thank you, Governor. Hello, everyone. Thank you very much for being here today. This issue is a long time coming. You know, as a mother of 3 children out in DuPage County, ages 16, 14, and 10, the opioid epidemic scares the daylights out of me. It should scare the daylights out of all of us. I've traveled through all 102 counties, and this epidemic is widespreading. I've interviewed a lot of people dealing with opioids. I spoke to Chad in northwestern Illinois, and he indicated to me that he was able to get on a plan to recovery. But before that, the face of addiction was a very different face. You see, before I even started finding out about this opioid epidemic, I thought that it was only subject to big cities, alleyways, people shooting up, and that's really not the face of this epidemic right now. It touches each and every one of us. With Chad, he worked in construction. He was hanging out with some friends, having a beer. Somebody dropped a firecracker in his beer. It blew up, and then he got glass all over his hands. He necessitated medical intervention, and his doctors put him on opioids, and he needed it at the time. But slowly, he got hooked on opioids. He started changing his friend network. Friends that knew how to go doctor shopping and be able to get all the opioids they wanted. So he changed his whole lifestyle, and slowly he went into heroin. Now, he's actually in a plan, and we pray for Chad every day. But like Chad, there are many other individuals dealing with this crisis, and we must address it head on. So to put it into perspective, right now, 274% of Illinoisans thus far, between 2008 and 2014, have faced opioid-related deaths, just in Illinois alone. So what have we done as a state? Well, ever since January, a lot of us, agency heads, have gotten together to try to develop a plan. Dr. Maria Bruni, raise your hand, she's got a lot to brag about. She went to Washington, and she was our face in Washington, getting $16 million to start addressing this issue in the state of Illinois altogether. It's a start, and she'll continue fighting for us in Washington. But truth be told, later on today, we're going to unveil a plan so that we could go into the nitty-gritty of this, because really it's affecting all of us. So with that, I'd like to also introduce a good friend in this fight, and it's Dr. Nirav Shah.
Thank you. Thank you, ma'am. Good morning, everyone. Thank you very much, Madam Lieutenant Governor. My name is Nirav Shah, and I am the Director of the Illinois Department of Public Health, and I'm delighted to join everyone here today to discuss the ever-worsening opioid crisis in Illinois. I'd like first to thank a few folks before I start. The first is our colleagues and partners here at Wandale Christian Health. We're delighted to be able to work with you and partner with you, and thank you for your generous use of this space as we launch today's executive action and the plan later this afternoon. I'd also like to thank the various stakeholders who are in the room here with us today. It wouldn't be but for you that we would be where we are and be able to continue this work. I'd also finally like to thank my colleagues from across the other state agencies. We've all been working together in a very concerted fashion for several months to develop the plan and this executive order, and I'm delighted that all of you could be here with us today. In recent years, Illinois has joined the rest of the country in grappling with what is really and truly the deadliest drug crisis in our nation and our state's history. Opioids claim more and more lives by the day, causing an immeasurable toll, both in terms of the loss of life, as well as the anguish that is visited on our communities. The statistics are really staggering. Last year alone, 1,900 people in Illinois died because of opioid-related deaths. For context, that's nearly twice the number of fatal car accidents in Illinois last year, and 1.5 times the number of people who died of a homicide. Scarier yet, the crisis is getting worse by the day. Last year alone saw a 76% increase in deaths as compared to just a few years ago. Simply put, the opioid crisis is the most significant public health and public safety issue of our time facing Illinois. As a result of that, concerted, coordinated action is necessary. And that's why I'd like to thank the governor for today's executive order that will allow state agencies to continue with the planning work that we've been doing over the past several months, as well as our coordination with the stakeholders who are here today, as well as those around the state. But despite our best coordinated efforts, many challenges will remain. Challenges like stigma can't simply be ordered away by an executive action. In many respects, the HIV crisis is the opioid crisis of 20 years ago. And just as with HIV, we didn't really start making inroads until we squarely addressed the problems of stigma. The same goes for opioids. Until we move from a place of misunderstanding to understanding, it will be very difficult to make a dent in the numbers that I shared earlier. Quite some time ago, I heard a mother whose son had died of a heroin overdose. She said that when your son dies of leukemia, everyone in town shares in your grief. Everyone brings you a casserole, and everyone shows up to the funeral. But when your son dies of a heroin overdose, alone, with a needle in his arm, no one shows up. No one feels your pain, no one brings you any food, and no one shows up to your son's funeral. The stigma here that faces individuals with opioid use disorder is real, it's unimaginably cruel, and its effects resonate throughout society. And just as with HIV, it won't be until we reckon with the fact that opioid use disorder is a medical condition, just like any other, and one that affects our friends, our families, and our neighbors, that we'll begin to make inroads. And at the same time, we have to recognize that people suffering from a medical condition need care, not incarceration. And we have to recognize that we won't be able to arrest our way out of what is fundamentally a public health epidemic. And we have to recognize that no matter its severity, resolution and hope are within reach. Only then will we be able to turn the tide of this crisis. Going forward, this afternoon, we will be unveiling our statewide opioid action plan, a document that lays out our roadmap for addressing this crisis going forward. That plan will only be successful with the continued coordination and support of the stakeholder community, many of whom I'm delighted could join us here today. We look forward to working with each of you as we implement this plan. I'd like to thank everyone for coming today and supporting the work that we're doing. We continue to look forward to working with you in the future. I'd like to now turn things over to Secretary Jim Demas, the Secretary of the Illinois Department of Human Services. Thank you very much, everyone.
Thank you, Governor. No one starts misusing opioids because they want to become addicted. No one wants this for their life. No one wants to wake up in the morning wondering where they'll get their next fix to control their pain and their cravings. No one wants to put their life and their family's livelihoods at risk. No one chooses to have this disease. But opioid use disorder is a chronic disease of the brain. It starts as a combination of genetic predisposition and environmental triggers, just like other chronic diseases such as hypertension or diabetes. And it results in physical changes to the brain's functioning, which lead to tolerance, cravings, and the compulsive and destructive behaviors that destroy families and create a large public health burden for our state. Even though that we understand that addiction is a disease, we still do not treat it as a disease. Stigma prevents us from treating addiction like the disease it is. It's estimated that there are 248,000 Illinoisans in need of some type of substance use disorder treatment, but who do not receive it. And stigma is a big reason why. Stigma creates fear that seeking help will result in job loss or being ostracized by family or friends. Stigma makes the parents of children with substance use disorders afraid they will be judged as bad parents and their children seen as bad kids who are morally weak. And fear and shame of coming forward has very real negative consequences on people's chances for recovery. However, stigma is only one reason people who need care do not get it. Services must be available for people who need care and who step forward to seek care so that they can find services in their communities. To that end, the Illinois Department of Human Services, under the leadership of Dr. Maria Bruni, who is our Assistant Secretary for Programs, was able to secure about $40 million in new federal funding this year, dedicated specifically to battling the opioid crisis. Those funds will be used to support prevention, treatment, and recovery support services. Those resources are supporting preventive programs for teens who begin experimenting with alcohol, marijuana, and prescription pain medications. We're also working to increase access to treatment, including the availability of medications that, in combination with counseling services, have proven to be effective in helping people on the path to long-term recovery. Lastly, we are investing in programs that provide recovery support services for people recovering from opioid use disorders so they can stay strong in their recovery. As with all chronic diseases, people with opioid use disorders will experience life events that will challenge the management of their disease. We understand that with people that have diabetes or hypertension, that they'll have periods of good recovery and they'll have periods that require more intensive intervention. The cycle of disease management continues throughout the course of a person's lifetime. The same is true for people with substance use disorder. Changing the conversation about substance use disorder is critical for us to effectively prevent and treat this disease. Today, the governor's signing of this executive order and the release of the state's opioid action plan is an enormous step forward in the direction of reducing stigma and improving our ability to meet the needs of those struggling with this disease. Thank you.
Thank you, Secretary Demas. I'd like now to turn to Dr. Tom Huggett to discuss what it's like being on the front lines of care. Dr. Huggett is the medical director here at Lawndale Christian Health Center. He's an active member of the Medicaid Advisory Committee and the 1115 Waiver Committee, but most importantly for today, is a family practitioner who himself treats for individuals with substance use disorder and in particular opioid use disorder. Dr. Huggett, thank you very much for being with us. The podium's yours.
Thank you, Director, Governor. As a family doctor here at Lawndale Christian Health Center on the west side of Chicago, I'm privileged and blessed to be part of a team that tries to respond to the needs of our community. Family doctors and those in primary care, especially at community health centers like ours, are specially trained to treat the whole family over time, working to improve the health of our communities. One of the greatest needs we see right now on the west side is preventing deaths from opioid overdose. Expanded medication-assisted treatment, behavioral health counseling, and social support are vitally needed as we work with our patients who want to leave heroin or opioid use disorder behind them. In our work here at Lawndale, as in many health centers across our state, providers and I treat patients using medication-assisted treatment with medications like buprenorphine, also known as Suboxone. Being able to get the prescriptions of Suboxone has been possible for the first time for many of our patients through increased access to insurance, especially expanded Medicaid. We are glad this event is being held on the west side because there's a lot of need here on the west side. State Rep LaShawn Ford has organized the West Side Heroin Task Force and has held several town hall meetings, greatly supported by Director Shaw, and we are happy to be part of these efforts here on the west side. As we see our patients, we have already seen many success stories of those on medication-assisted treatment who are now feeling much better now that they're not using heroin. They're working a job, like at Dunkin' Donuts, like one of our patients, and are reunited with their families. I have one patient who reunited with his daughter after 9 years of not seeing her and seeing 2 of his grandkids that he has never seen. But there's much work left to do and many more people who need our help. The governor's executive order is just a beginning to achieve the goals of reducing deaths. As we see patients in our communities, we as doctors need to use evidence-based strategies that really work. It needs to be easier for us to use the prescription drug monitoring program, for example, in our offices as we see our patients. The PMP needs more resources to upgrade their systems. Reasonable prescribing and dispensing guidelines developed with physician input and working with insurers can prevent and limit the overprescribing of narcotics. And finally, we need to strengthen residential and inpatient programs so patients can get the care that they need when they need more than what we can give in the office. The message to parents and families where heroin is a problem is this: treatment is available, treatment works, and doctors and counselors want to help you. Ask your doctor about treatment or ask to be referred to somebody who can prescribe medications like buprenorphine or Suboxone. To prevent deaths from overdoses, everyone, including family members, should have naloxone or Narcan on hand in the house if they're going to be around people who might overdose. Lives can be saved, and I know many lives have been saved with our patients in overdose situations by giving naloxone. We look forward to working with the state, county, and city stakeholders as we put the Opioid Action Plan into actual practice for the good of our patients and our communities.
Thank you very much, Dr. Huggett. Dr. Huggett said something that I think is important to underscore. Treatment works. And joining us here today to personify that is Miss Jessica Gurkey, who's going to share her story of having lived with this experience and coming out of it. Jessica, thank you very much for being here and showing the bravery of sharing your story. I'd like to invite you to the podium. Thank you.
Hello. First, I want to say how honored I am to be here and thankful to the governor and everyone else who worked to launch this plan and sign this order. I can tell you personally that this is a crisis, and it is important that we talk about it and recognize how it affects everyone, our communities across the state. With gratitude, I can tell you I stand here with 8.5 years sober. There's light at the end of the tunnel. It is not easy. It got worse before it got better. But with the right services in place, you can battle back and reclaim your life. I was so young when I started using. Life was overwhelming. I used drugs to escape because that's all I knew. I did this for 8 years. I lost everyone and everybody. I was in and out of prisons and treatment centers, and they deemed me hopeless. Luckily, despite all the bridges that I burned in my personal life, someone reached out and made an offer, and I was too defeated to refuse. I returned to drug court after being released from prison once again, after starting using, and the judge asked me if I wanted help, and I said yes. And I meant it. On my journey, people asked me what was different this time. And if I was honest with you, I would have to tell you was that emotional bottom that I had. I was defeated. I had to make changes. Was it the most difficult thing that I've ever done? Yes, it took work. But I'm grateful every day that the life I have today. I'm grateful to say that with my new life, I'm back in school, I'm getting my degree, and I can also help people who are like me. I share my story, helping others who suffer from addiction. I help families, and I continue to work this journey with other people in recovery. This crisis does not discriminate. My story is just one of many who are addicted to opiates. I'm glad I found a way out of the darkness. It looks like the state's plan is to understand the value and prevention, in addition to providing treatment and recovery services. More importantly, the fact that we're all here today is the first step in ending this crisis. More importantly, this is a crisis about the people that we love. Our families, our communities, everywhere. I'm here today because there is hope. I made it out, so can they. Thank you again for letting me join you in your efforts to stop this devastating effect on the epidemic. God bless.
Jessica, I think I speak for everyone here in this room where we commend your story. Thank you so much for sharing it with us. It really does give everyone out there hope. So thank you so much. We're now going to move to the signing of the executive order.